Welcome to the channel. Hi everyone, I'm a respiratory therapy student just like you, and this channel was created to help us learn and survive RT school together. Here we'll break down topics like lung anatomy, ventilation, respiratory diseases, and clinical concepts in a simple, student-friendly way. I'll be sharing study tips, explanation, and things that I'm learning along the way. No pressure, no perfection, just growth. Whether you're just starting the program or deep into clinicals, you're not alone. Let's study, support each other, and get through this journey one breath at a time. Respiratory care. Oxygen therapy. Oxygen therapy, according to the respiratory care, is the administration of supplemental oxygen to a patient to treat or prevent hypoxia. In respiratory care, oxygen therapy is a medical treatment in which oxygen is delivered at a higher concentration than room air, which is 21%, to improve alveolar oxygen levels, increase arterial oxygen saturation, and support cellular metabolism. Therapeutic administration of oxygen first occurred in 1798. In 1878, Birth showed the lack of oxygen caused hyperventilation. Oxygen is a drug administered to patients at higher concentration than room air to improve the alveolar oxygen levels and increase arterial oxygen saturation. Oxygen therapy is the administration of supplemental oxygen to a patient to treat or prevent hypoxia. Aerosol medication. Aerosol therapy is defined as the administration of liquids or powder aerosol particles by inhalation to achieve a desired therapeutic effect. Bland aerosols, example sterile water, or saline solutions, or solutions containing pharmacologically active drugs may be administered. Short-acting bronchodilators such as isoproterenol, isoeterine, metaproterenol, albuterol sulfate, and levobuterol were introduced primarily for the emergency treatment of acute asthma attacks. Late in the 1990s, long-acting bronchodilators were introduced for the treatment of COPD. Mechanical ventilation. Mechanical ventilation is a form of life support therapy in which a mechanical ventilator assists or replaces spontaneous breathing by delivering positive pressure to the lungs in order to maintain adequate ventilation and oxygenation. In respiratory care, mechanical ventilation is used for maintaining adequate oxygenation, removing carbon dioxide, reducing work of breathing, and to support patients during respiratory failure, which allows the lungs and respiratory muscles to rest and heal. There are two types of mechanical ventilation. The first one is invasive mechanical ventilation, which requires an endotracheal tube or tracheostomy and is used for critically ill patients. The second one is non-invasive ventilation, which uses a mask, can be either BiPAP or CPAP, but no artificial airway is also used for conditions like COPD, exacerbation, and sleep apnea. In 1967, the addition of positive end expiratory pressure, which is known as PEEP, was introduced as a feature to help patients dying from the newly described acute respiratory distress syndrome known as ARDS. The use of PEEP helped to stabilize the alveoli and keep them from collapsing at the end of exhalation. VAP. There are always a potential for one or more serious complication. The most common is an infection referred to as ventilator-associated pneumonia, also known as VAP. There has been a concerted effort to try to support the patients in adequate ventilation and or oxygenation by using non-invasive positive pressure ventilation or high-flow nasal cannula therapy in order to avoid the need for endotracheal intubation and the resultant risk of developing VAP. Airway management. Airway management involves the use of various techniques and devices to establish or maintain a functional airway. Airway management refers to the assessment, maintenance, and protection of the patient's airway to ensure adequate ventilation and oxygenation. The goals of airway management are as follows: maintain a patent airway, prevent aspiration, ensure adequate ventilation and oxygenation, facilitate secretion removal. There are different types of airways. The first one will be artificial airway, which could be an endotracheal tube or a tracheostomy tube. They are used to protect the airway, also used for mechanical ventilation and for frequent suctioning. The second one is adjunct airway that help prevent airway obstruction in unconscious and semi-unconscious patients. One of them known as oropharyngeal airway, the second one nasopharyngeal airway. But there are some complications of poor airway management, which could be as follows: airway obstruction, aspiration, hypoxia, VAP, tracheal injury, accidental extubation. Pulmonary function tests. Pulmonary function tests are also known as PFTs, which is a group of non-invasive diagnostic tests used to measure lung function, assess ventilation, lung volumes, and gas exchange, and help in the diagnosis, evaluation, and monitoring of respiratory disease. The purpose of PFTs. In respiratory care, PFTs are used to diagnose obstructive and restrictive lung disease, assess severity of the lung disease, monitor disease progression or response to therapy, evaluate preoperative respiratory risk, assess disability and impairment, differentiate pulmonary from cardiac causes of dyspnea. One of the main components of the pulmonary function testing is the spirometer, which is used to measure the following PFTs. FEC, which is the forced vital capacity, FE1, which is the forced expiratory volume in 1 second, the FE1 versus FEC ratio, and the PEF, which is the peak expiratory flow. American Association of Respiratory Care was founded in 1947 in Chicago. First, it was known as the Inhalation Therapy Association. Later, it became the American Association for Inhalation Therapists. And in 1954, the American Association for Respiratory Therapy, also known as ARRT. In 1973, the American Association of Respiratory Care, which is the AARC, and today it continues to be known as the AARC, known as the American Association for Respiratory Care. Okay, everyone, thank you for watching. Subscribe to see future videos, and I hope to see you along the way. Subscribe.